So cardiovascular disease is any disease that affects the heart and the heart vessels. The burden of this disease is very tangible, causing around 18 million deaths worldwide. In the United Arab Emirates, around 40% of mortality or death is related to this disease. Now, having said that, the good news is around 80% of this disease is preventable and treatable. So the complications of cardiovascular disease are a number of complications, and without alarming our viewers or listeners today, there are consequences such as having heart attacks, having a weak heart, which is called heart failure, or abnormal rhythm, which are rhythm problems. Luckily, all of these diseases can be treated and can be prevented even. And I like to simplify it by a simple nomenclature for us to remember, and it's the classical ABCDE classification. ABCDE classification simplifies the way to look at risk factors. So A would be assessment, and that's very, very important because with assessment we're able to ascertain all the other risk factors, giving time for us to see our doctor on a regular basis. B is actually blood pressure, and elevated blood pressure has been linked to a number of cardiovascular diseases such as heart attacks and strokes. And so much so that there are places where they have walk-in blood pressure machines, and these are very good ways of assessing blood pressure for a lot of patients who have no symptoms. C would be elevated cholesterol, and a lot of the cholesterol that is elevated is not only dietary, but a lot of us are born with the inability to clear our cholesterol and having a very high cholesterol level. The other C is the bad C, which is cigarette smoking, and that's the number one preventable risk factor. And unfortunately, we do see a lot of our younger patients presenting with heart attacks, them being smokers. The next would be D, which is diabetes, and diabetics do carry higher risk factors for developing cardiac disease, and even when they develop cardiovascular disease, they have a more harder prognosis, meaning burden of that disease with time. E is my favorite, which is exercise, and it's important to think of exercise not only in joining a gym or being part of a team, but even thinking about parking the car far and walking, using the stairs, and keeping in mind exercising 3 to 4 times a week, half an hour to 1 hour, should be a very good starting point for our healthy exercise and lifestyle. With World Heart Day approaching on September 29th, let's all make a stance and let's make a resolution of managing and controlling our cardiac risks with eating less, exercising more towards a healthier heart together.